Hi you guys, welcome back to another video. It is Shamira and I'm back to do another how to look up CPT codes in your CPT book. A few of you told me that these are your favorite types of videos or coding videos. If you have any other coding videos that you like from me or preferences, let me know down in the comments. So let's just jump into this video because we have a few cases to go over together. Feel free to pause the video before I get to my answer and see if you can do it on your own with your coding book. I think that you guys will learn a lot better if you do it that way versus just watching me do it. So, let's begin. A forensic pathologist performed a gross postmortem examination on a stillborn infant. The exam included the infant's brain, but did not include the infant's spinal cord. How should the pathologist code for this service? These are the terms that stick out to me: the gross postmortem and the fact that this exam included the infant's brain but did not include the infant's spinal cord. So let's head to the back of our CPT book and we're going to be looking for gross postmortem or postmortem. We're going to be looking for those types of terms. Okay, so you see here at postmortem, it says to see autopsy. So now we need to go to the front of the index to autopsy. And let's see what we find. Up here, it says autopsy, forensic exam, gross exam is 88000 through 88016. So let's go over there. So 8800 first. And here we are at anatomic pathology, postmortem examination. It says procedures 88000 through 88099 represent physician services only. Use modifier 90 for outside laboratory services. And our question says that we are billing this for the pathologist. So this is not going to be a outside laboratory type service. Looking at these codes here, we see that it says necropsy or autopsy. Gross examination only would be the 88000, but we have the semicolon without CNS, or the other procedures below that are indented. So we want to keep the fact that this was a gross examination only, but we're going to include the fact that it was a stillborn or newborn with brain, because our question had said this was a stillborn infant and the exam included the infant's brain, but did not include the infant's spinal cord. So we're not going to be looking at 8807 or 88012 because this is for an infant that was alive. So 88014 would be the correct CPT code for this question. Moving on to our next question, it says, during a surgical session, the pathologist received and performed analyses on 4 separate biopsies from the vaginal wall and 2 from the cervix. How should the surgical pathologist code for this service? This is what I pulled out from this question, the fact that we did 4, or that the pathologist did 4 separate biopsies from the vaginal wall, meaning there's going to be 4 different specimens from the vaginal wall, and then there's 2 separate specimens for the cervix. So let's look in the back of our CPT book, and we're going to go to, let's say, biopsy. All right, now that we're over at biopsy, it was the vaginal wall and the cervix. So right here, we have vagina 57100. Oh, actually, no. That's funny because we are billing for the pathologist. If we were to go to, and this is why it triggered me, because 57100 is if you're billing for the physician that actually performed the procedure. So let's go to pathology. What did our question say? Oh, right. We have to go to surgical. Here we go. You guys, almost lost myself for a second, but right here. So when you see in your question, during a surgical session or from a surgical procedure, you want to go to pathology and laboratory and then look for surgical pathology. So 88300 through 88399. Right over here for surgical pathology, it says services 88300 through 88309 include accession, examination, and reporting. They do not include the services designated in codes 88311 through 88365 and 88399, which are coded in addition when provided. The unit of service for codes in this range is the specimen. Right in your book, unit of service per sample or specimen. So I'm going to turn my page because remember it told us 88300 and this is for surgical pathology for a gross examination only. And there's some more information that you will want to skim through quickly as you are doing your exam. So what you would normally do is you would look through these levels until you find the vaginal wall or vagina and the cervix. And I don't see anything here. But once we get to 88305, we see cervix biopsy. Remember, we did 2 samples for the cervix. And where's my vagina? Right here, vagina biopsy. So we did 4. So what we will have to do is we would bill, and I don't see any other code. So it goes from 88305 and it jumps to 88307. There is no 88306. So we are billing 88305 with 6 units. I'm not sure why my lighting just changed, but yes, we are billing 88305 with 6 units. Moving on to our next question. It says patient returns to office today for 6-year-old well child exam. The following vaccines were recommended and administered at this visit: the DTaP, IPV, MMR, varicella, and annual influenza shot. How are the codes reported for this visit? And this is actually my first multiple choice question that I'm showing you guys. I wanted to point out some information that I want you guys to pay attention to help save you time on the exam. The very first CPT code that they give us is the annual well child check exam. These are preventative medicine services. And in our CPT book, it says the extent and focus of the service will largely depend on the age of the patient. So this is a 6-year-old patient. If we look at 99392, 99393, 393, and 394, we can easily eliminate 392 because that is for 1 to 4 years old. And 394 is from 12 to 17 years old. So A and D, we can get rid of off rip. We don't even have to do much of any of that. So now we are looking at B and C. Process of elimination is going to help you guys so much on the exam. And for the most part, they give you 2 answers that you can eliminate and then give yourself a 50-50 chance. So always do process of elimination. But looking at B and C, you see that every CPT code lines up. So that tells you that all those codes are right. Do not waste your time trying to look at 90471 in your book because obviously if these are your 2 last options, those codes are right. You'll see that 90657 and 90658 are the determining factor. So if I go over to 90657 and 90658, I could not figure out what the difference was between the 2 except for the milliliters that was given. And I had to read the rationale on this one in the practice exam that I was doing. And the reason why was because 90657 is given for patients that are under 3 years old. And 90658 is for those that are 3 years old or older. So I wrote that in my book. You want to write that in your book right now. Okay? Write that down because this did not tell me anything about the age. Neither did it tell me in the guidelines on either page. So write that down and our correct answer is going to be C in this case. But Another thing that I wanted to point out, you can see in A, they billed 90471 4 times. That is wrong because that code is only reported once, and for each additional vaccine given, you want to be reporting 90472. Another thing that I wanted to point out was for D, you see that it says 90471 and 90472, and that's it. What they are saying on the claim is there was a annual well visit, 2 vaccines were administered, and then you have 1, 2, 3, 4, 5 total vaccines or toxoids that were given to the patient. So if you only administered 2, did you send the patient home with the vaccines? Our next question says, patient is 23-month-old with end-stage renal disease receiving dialysis twice a week awaiting kidney transplant. The patient's parents receive bi-weekly face-to-face counseling services regarding the patient's care and end-stage renal disease status. What is the correct code for the patient's dialysis care? And this is what I highlighted from this question. The end-stage renal disease, the patient receiving twice a week and the parents receiving bi-weekly counseling. In the back of your book, you would have went to dialysis, and you see it tells us to go to end-stage renal disease. And once you get there, you will see end-stage renal disease services dialysis. So let's go over there. And right here we see it says dialysis 90951 through 90970. And I'm assuming these are going to be monthly sessions because it said that we would be doing these until the patient has their kidney transplant. So it could be monthly, which is the same code range, except it stops at 90966. So let's head over there in the medicine section. Once we come over here in the medicine section, we see end-stage renal disease services 90951 through 90962 are reported once per month to distinguish the age-specific services related to the patient's ESRD performed in an outpatient setting with 3 levels of service based on the number of face-to-face visits. ESRD-related services by a physician or qualified healthcare professional include establishment of a dialyzing cycle, outpatient evaluation and management of the dialysis visits, telephone calls, and patient management during the dialysis provided during a full month. And then they also give some more information, but I got the gist of what they were saying here. So what they were saying is these are age specific, so you want to pay attention to the age the patient is. And these are the 3 level of services that they were talking about. It depends on how many face-to-face visits that the patient had or counseling sessions that the patient has per month. So our question had said it was a 23-month-old, and we're going to be looking at younger than 2 years. The parents come in bi-weekly, so that's twice a month. So we're not going to be looking at this one because this one is for 4 or more face-to-face visits. This one is for 2 to 3 face-to-face visits. So our correct CPT code for this question is going to be 90952. Let's do another one similar to that one, but I'm going to switch it up a little bit. So this time we have a 5-year-old with end-stage renal disease, and she's receiving dialysis once a week. The parents receive 2 counseling sessions per week regarding the patient's care and ESRD status. What is the correct code for the patient's dialysis care? And this is what I have highlighted. So we already know that the amount of times the patient gets dialysis is not necessary for us to know. What we need to know is how many times the patient and the parents have that face-to-face encounter for counseling. In this question, it's 2 per week. So this time we're going to be looking at 90954 because we know it's a 5-year-old, and the parents receive 2 counseling sessions per week. So 2 times 4, that's 8 sessions. So 90954 is going to be our correct CPT code for this question. For our next question, we're going to go back to a vaccine one because this one had me stumped and I could not figure out what they were talking about in the rationale. So maybe you guys can help me understand this question. But I know the right answer, but I just didn't understand what they were saying. So let's begin. The patient was seen for a 5-year-old child exam. The following vaccines are recommended for the patient at this visit. These ones here. The pediatrician counseled the patient and her parents on the health risk and side effects associated with each recommended vaccine. What is the correct code for these vaccines? And this is what I have highlighted. All the vaccines that were administered. Pay attention because this time the pediatrician counseled them on each vaccine that was recommended and administered. So in your CPT book, you want to look at, in the back of your book, if you go to immunization administration, each additional vaccine toxoid, and then right below that it says with counseling, and then it says one vaccine toxoid with counseling. So the with counseling is what we want to pay attention to. 90460 and 90461. And once we come here, we see a little bit of guidelines here. It says report vaccine immunization administration codes, 90460, yada yada, in addition to the vaccine and toxoid codes. So make sure you have your stick and stuff, is what we like to call it, what the patient received when you injected them or whatever you given them. You have to have 2 codes. So coming down, it says a component refers to all the antigens in a vaccine that prevent diseases caused by one organism, 90460 and 90461. Multivalent antigens or multiple serotypes of antigens against a single organism are considered a single component of vaccines. Combination vaccines are those vaccines that contain multiple vaccine components. So I think that kind of answered my question, but I'm not 100% sure. So looking at 90460 and 90461, I have some information written in my book to help me remember how I'm supposed to build these. So it says for 90460, immunization administration through 18 years of age via any route of administration with counseling by a physician, first or only component of each vaccine or toxoid administered. And this is where I got confused because it says the same thing that 90471 says. For each one, it says one vaccine, and then for each additional is on 90472. But over here, I had to write in my book counseling per vaccine because looking at the answers, they billed 90460 5 times. And that did not make any sense to me because 90460 to me should have just been for the first vaccine. And then we would have done 90461 4 times, similar to what we did when we had that question and we went up there. But they had their rationale, and I'm going to show you guys what their rationale had said, and that confused me even more. So maybe you can help me understand what they're talking about. But 90460 to me means the first vaccine with counseling, and then 90461, because the semicolon is here, all this information before the semicolon is included in this charge right here. So we should only be billing this 1 time and this 4 times for the 5 vaccines that the patient and parents received counseling for. But for some reason they want us to bill this 5 times and this 4 times. So I'm not sure how it's going to show up on your exam, but I did want to show you guys those vaccines because they were talking about 2 of the vaccines had 3 components in them, and I believe it's the DTaP here because it has 1, 2, 3. Those are 3 components, and MMR, measles, mumps, and rubella, that has 3 components. But if we're counting by components and we're doing that, wouldn't that be 6 components plus the other one? So the varicella that the patient was given and polio, that's 1. So if we took 3 plus 3, that's 6, 7, 8. 8 up here. And then our last one was for the influenza, which was here, and that one I'm going to say is for the 90460. So I come up with 8 components. So I'm totally confused with this question. So maybe you guys can, make it make sense for me. But yeah, the answer to this question was A. But I'm still a little bit confused when it comes to trying to bill each additional vaccine or toxoid component, and then they tell me that 2 of the vaccines have 3 components. Like, what? At this point, let's just get away from this question. But let me know what you think down below. Our last question, and this one's going to be a lot easier. I'm actually going to go through it differently, and we're not going to use the index. Now, you want to use the index when you're taking the exam. This is kind of like if you barely have enough time, you don't have enough time to get to the index, and you just want to find the right answer, okay? A physician performed an endoscopic resection of a 2.3 centimeter bladder tumor. What is the correct CPT code? And this is what I have highlighted. The endoscopic resection of a 2.3 centimeter bladder tumor. Again, I do not recommend, if you are taking the exam, I don't recommend you do it this way because it might take you more time to get to the right code. But this is if you have free time, if you're just doing practice exams and you want to see if you can get there on your own. You want to know your anatomy. So the bladder procedures are going to be in the urinary section of your book, which is the 5,000. You can't really see it because of the glare, but the 5,000 section. And how they outlined my book, which I didn't even realize until today, is we start from the top. We start at the kidneys, then we go through the ureters, and then the bladder, and then the urethra. I thought that the CPT was lined up for the procedures in the front to be about the urethra, then the bladders, then the ureters, then the kidneys. But for some reason, we go the opposite way. So like I said, we start at the kidneys, and there's kidney. And all these procedures, after you see the red kidney section, are going to be on the kidneys until we get to the ureters. So once you get to the red ureter mark, you are now seeing procedures on the ureters. And all through here are not going to be kidney specific type procedures. And then we get to the bladder. So this is where we would need to be. And you see, for the most part, every section has the same information. They have incision, then they have removals, excision, introduction, and then we have urodynamics for the bladder section. We have repairs, but our procedure that we are doing is a resection. So, and it was an endoscopic procedure. So we have laparoscopy, and that's when you're using small incisions and you're putting a scope in. So they didn't do that. They did an endoscopy. So they're taking a camera up through for this procedure. And here we go. We are at endoscopy, cystoscopy, urethrooscopy, and cystourethrooscopy. So this sounds like where we need to be. So let me turn my page here. Oops, went too far. And we see that at the top, we start with 52000, but we didn't just do a scope only, so we need to keep looking. And we run into transurethral surgery. So we are still under endoscopy type procedures. So don't think that we are now in open. We're not. You see, it still says cystourethrooscopy. How do you get to the bladder? You have to take the scope through the urethra in order to get to the bladder. So now we need to start looking for resections or removals for endoscopic procedures. And I come up here up top and we have cystourethrooscopy with fulguration or treatment of a minor lesion. So that's just treating, that's not removing. So let's keep looking. Cystourethrooscopy with fulguration and or resection of a small bladder tumor, 0.5 up to 2 centimeters. But that's not what we had. We had a 2.3 centimeter bladder tumor that was resected. So our next one down is medium bladder tumors, 2 to 5 centimeters. Our correct CPT code is 52235. Do you guys like doing it that way? I kind of like doing it that way, but if you are still kind of in the beginning stages, I don't recommend you try and go this way. Yes, it was kind of fast, but if you want to sit here and do it my way on your exam, that's your choice, but I prefer you guys do it the right way, and that's go to the back. So what would that look like if we went to the back of our book? You would go to bladder procedures, right? When we go to bladder, we come down here to endoscopy, and then we see, endoscopy. We are in the bladder section right here, tumor, and also right here it says tumor. This is fulguration, this is excision. Do we have resection? Let's see. Look, it says the same thing, 52500. I don't know why it keeps trying to tell you guys to go there. But anyway, oh, look, that's just a bladder resection, but not for a tumor. That's why. So tumors, excision, or fulguration, go to 52234. And that is it for this video. I want to thank you all for watching. If you made it till the end, give the video a thumbs up, comment down below, and I will see you all in my next one. Bye.